Thanks, Paige. Thanks, HAQAST team, for putting together that video. It was really great to see everyone's comments. And somehow that got edited as me saying the best thing to come out of HAQAST was this project that I'm going to talk about. That's not to speak for all of HAQAST. That should be the best thing out of the projects that I was involved with was the one that I wanted to say. Just put that out there. And with my slides, I'd like to show specifically how we were using share just PowerPoint. Specifically how we were using satellite data and estimating PM2.5 concentrations, and how that was used within a tool called LEAP IBC, LEAP Integrated Benefits Calculator, that will be discussed more in this panel, and that I had mentioned in the summary video. The CCAC, this organization that Elsa is going to tell us more about, is a Climate Clean Air Coalition, is an organization that serves member organizations and countries all around the world. And so part of what we're trying to provide for CCAC member nations is estimates of how changing emissions impacts PM2.5 and PM2.5 associated health. And so we needed a way of estimating PM2.5 concentrations throughout the globe in kind of a uniform and consistent fashion. And this is really a place where satellite-derived products have their strength. They're globally available. There's products like the one shown here from Aaron Van Dunkelaar that combine measurements from multiple satellite instruments, fuse that with information from models and measurements statistically, and develop these PM2.5 estimates that are not only, as I mentioned, globally available and uniform and consistent, but also estimated at a very high resolution, higher than we can typically estimate with a global model. And other HAQAST members, such as Pat Kinney's group or Jason West's group, have shown that if you use a global model at traditional scales of hundreds of kilometers, you could make substantial errors in estimating PM2.5 exposure for health impacts. So this data set derived from the satellite information is really well suited for this application. The other part of the sort of technical components that go into this LEAP IBC tool was running a bunch of geochem adjoint model calculations to apportion the exposure estimated by the satellite in particular countries to emissions from particular species and sectors and locations. And so here's an example of that, showing the apportionment of the PM2.5 exposure in Bangladesh to SO2 emissions in the surrounding region. So you have an impact of SO2 emissions both in Bangladesh, but also to sources. It could be upwind. We ran these sorts of calculations, apportioning the satellite-derived PM2.5 exposure to different sorts of emissions for each of the CCAC member countries, and then eventually just sort of crank these out for most of the countries in the world. So this ended up being hundreds of thousands, I think more than 1 million CPU hours. The benefit, though, is that we're taking all of that time spent on NASA supercomputers and condensing it down into these response coefficients that are then included in the LEAP IBC tool that people all around the world can use on their desktop. This relationship between emissions and atmospheric responses is now already been calculated for them, so they don't have to repeat that really expensive simulation. So as a user, they're essentially using LEAP to estimate some sort of emission scenario, shown on the left, that gets multiplied by a response coefficient calculated from our model, and that would project an estimated change in PM2.5. Lastly, the expertise on our team from Susan, from co-investigators on our HAQAST team, Susan Anenberg and Pat Kinney, helped us develop a way of translating these concentration changes into changes in human health impacts, following methods laid out by the Global Burden of Disease, such as using these relative risk functions of PM2.5 exposure. So those are sort of the technical pieces that we were using. I'll show you a quick example and then follow that up with, I think, some lessons learned on my part. For the results shown here, emissions were developed using this LEAP tool for determining NDCs, nationally determined contributions for the Paris agreements, and also national action plans for reducing short-lived climate pollutants. And here we're looking at the results for the sort of most comprehensive emissions mitigation strategy from Bangladesh showing scenarios starting in 2010 out to 2040. And what they found is that they would reduce PM2.5 concentration and exposure by about 10 micrograms per meter cubed if these mitigation measures were enacted in Bangladesh alone. They could double that if these mitigation measures were enacted in the surrounding upwind regions. This also then translates into avoided premature deaths. You see that this tool breaks down the relative role of emissions that are domestic versus emissions that lie outside of the country versus sort of a natural baseline. Also, you see that the premature deaths are increasing as we go from each time slice here because of an increasing population. So the challenge and the importance of addressing this issue is increasing in time, but still these measures are able to reduce that and combat that. So that's just a little bit of flavor of the kind of results from this tool. There's a lot more details in our in-depth video. Lastly, lessons learned from HAQAST, and actually really from ACAST as well. This work started in the days of ACAST when Susan was a stakeholder and not a team member, but that we can use these satellite drive estimates of PM2.5 in a lot of applications that tend to be on the basis of looking at scenarios, trends, and impact evaluation, and less so for monitoring and compliance. But the availability of the satellite data provides a basis for capacity expansion. That's something that I heard quite a bit from our stakeholders, that this really helped them build programs that may eventually lead towards expanded monitoring in locations where the current data sets were either sparse or not existent. That being said, once there is eventually more data on the ground to measure PM2.5, there needs to be ways to connect what we're seeing from space with what's measured on the ground. Sometimes these are different, and we need to think carefully about how to connect and fuse these data sets to avoid erosion of confidence in the satellite drive estimates. And I don't want to end on that note, which maybe sounds a little negative. It's not. I think there's a positive note here, is that HAQAST was particularly well equipped to address this, and we had Tiger teams formed specifically to look at these sorts of questions relating low-cost sensors, in situ measurements to maps that we can generate from satellite, and trying to understand what are the gaps and what are the differences. And I think that, in combination with the future measurements that we have, looks very, very promising.
Great, thank you, Daven. And Young, you are listed next. Would you like to go next?
Sure. I want to kind of follow the casual style that Brian Duncan used to talk about my experience with the HAQAST and the HAQAST. So I teach in the School of Public Health. My work mostly focuses on the application of satellite remote sensing in air pollution exposure modeling and health impact research, health effects research. I sort of witnessed the evolution of satellite-driven PM2.5 model development. I remember when I started building this kind of models back in 2004, my model resolution is 1 degree by 1 degree. The entire US is made up of a couple hundred boxes. You can hardly imagine how that can be linked to any practical applications. It was limited by the satellite data resolution and then also our modeling methodology. For the past 15 years, we really have seen the explosion and sort of the acceptance of Earth observations as the major driver for characterizing even neighborhood level air pollution distribution and time trends. With that improvement of resolution and accuracy, we finally can say as researchers that our models would actually serve decision-making processes, right? And personally, I feel that at the beginning, I sort of selected a target site because they're interesting to me. But now, after the HAQAST and HAQAST, I start to have the stakeholder and the applications in mind when I build my models and try to design my study. I think at the current stage, I have sort of two recollections or lessons learned from my experience. One is really for health effects research of PM2.5 resolution and accuracy is key because the downstream applications also have multiple sources of uncertainty. So they require the upstream exposure estimates to be consistent in time and space and actually more accurate than the data they would take in for their epidemiological study. And I'm very proud to say with the with the support of the applied science programs and then all the investigators, stakeholders, we're finally kind of reaching that goal that we're approaching a level of accuracy and confidence that the satellite-driven exposure data sets can be used as the foundation to drive a lot of the health impact assessment. And another thing is that I've spent a lot of time investigating the possibility of integrating satellite data, model simulations, and local sensor measurements into sort of a united modeling framework. And that has direct implications in environmental justice applications and then in sort of outreach efforts to previously underrepresented populations and regions. And again, with the development of the new sensors, we would have even better and stronger capabilities to do this line of research and really connect with multiple levels of stakeholders. So that's what I have. Back to you, Susan.
Okay, thanks, Yang. And continuing along the order in which we're listed in the webpage, I will go next and then hand it off to Elsa. So I have had the pleasure of being involved in HAQAST through Daven's Tiger team and also, Daven's core project, and also was involved in the earlier iteration of HAQAST back when I was an EPA employee. So I've been able to observe the evolution as well in HAQAST and HAQAST and really appreciate the way that this effort has evolved to really take into account stakeholder needs and requests more directly. And the work that I just want to show a couple highlights for me of some of the instances that I was involved in through Daven's HAQAST team here. But really it's the culmination of the work of many people, both involved in HAQAST and in the broader community as well. And I think this is a real testament to the need for, not just the applied, the very applied sciences that I was, sort of the world that I was working on in connecting science to stakeholder needs. But this applied science wasn't possible without all of the sort of more basic science work by many others that came before me. And I think this project here on PM2.5 mortality in 250 cities worldwide shows that story really well, because here what is we provided the first estimates of PM2.5 attributable mortality in hundreds of cities all across the world in a way that was globally consistent and compatible with the global burden of disease study. And this was really enabled by the global burden of disease study using PM2.5 concentrations that were globally gridded based on satellite aerosol obstacle depth observations. So it really takes the knowledge that so many people in the field have been working on for many years, trying to figure out how to convert aerosol obstacle depth observations into surface concentrations that can be used for applications like this. But what we found here is that PM2.5 attributable mortality rates ranged about tenfold all across these hundreds of cities all around the world. And they followed a different pattern between PM2.5 concentrations and death rates. So it became clear to us through this project and others that, if you only focus on the concentrations alone, you would not be getting part of the story here. The other part of the story, the health status of the population, they're breathing the polluted air. So when you account for both PM2.5 concentrations and the health status of the population, you can understand the variation in PM2.5 mortality across all these cities worldwide. These results were not just published in a journal article, but also transmitted to various stakeholders, one of which is the C40 Cities organization, which is working to get cities around the world to commit to carbon neutrality. And they're using these data in a couple of different ways. One of them is just to highlight for cities around the world that are making pledges to get to carbon neutrality, to show them what the current levels of air pollution and air pollution health risks are, so they can understand the local environmental and public co-benefits of taking action on CO2 emissions. And then secondly, also building the data as a sort of a baseline in the same way to a new analytical tool that we're helping C40 cities create called Pathways AQ, where cities can interact with the tool and quickly quantify the air quality and public health co-benefits of different pathways to get to carbon neutrality. I was also fortunate to be a part of the NASA HAQAST high-resolution Tiger team, which I'm sure we'll hear more about from others. But here, we were trying to identify within cities. So the previous project that I just showed was sort of a sectional view comparing cities all around the world. Here, we're looking within individual cities. Can we identify hotspots of air pollution health risks within individual cities? So we looked at 4 U.S. cities: Boston, New York City, Los Angeles, and Washington, and we did find that there's quite a bit of heterogeneity in terms of air pollution health risks if you look geographically and between different population subgroups. This is still a work in progress, and I think one of the most rewarding parts about HAQAST related to this project was that we were able to connect directly with the city officials who might use these data in their decision making and get their feedback. And in fact, some of the feedback we got was, this map we don't quite understand why health risk would be high in this area and low in this area, which then caused us to go back and look at our methods and make sure we're using the data sources that are the best available and most accurate. And so this is sort of an iterative process that we improve on over time. And again, shows the value of working directly with stakeholders throughout the course of a project. And then the final thing I just wanted to highlight was a lessons learned commentary that the HAQAST Indicators Tiger team wrote. The HAQAST Indicators Tiger team did not just look at PM2.5, though we're in a PM2.5 panel right now. In fact, PM2.5 is a little bit more mature air pollution indicator that has been developed over the past years. We did not focus on PM2.5 and instead focused on various other indicators that needed a little bit more scientific research to get them to a place where they can be used directly by stakeholders. And those topics are listed here. So if anyone is interested, there are various lessons learned that are in this document, which was published in the journal GeoHealth last month. But just some of the lessons learned that I had are that, working with stakeholders is really immensely valuable for the reasons that I just mentioned on the previous slide. But it does require a lot of time and effort and iteration. And as, Brian and others have said, some relationship building and, time working in different formats to come to mutual understandings of what the stakeholder needs and what the scientists can produce. It also requires some flexibility. I think Brian also mentioned this, that sometimes our project that we envisioned when we proposed them morph into something different by the end. I view that as a good thing. That means that we're being responsive to the stakeholders and ensuring that the science that we're doing is is actually meeting stakeholder needs. There's also a balance between mature and nascent data sets. So some of these indicators were a little bit more mature in terms of the scientific methods that were available to produce data sets. Others were just completely new. And so we need to work in parallel to, continue to build nascent stakeholders while at the same time, sometimes even just reformatting or repackaging or, figuring out new ways to communicate mature data sets that are also available. And then, I think that one challenge that arose in this Tiger team was that sustained collaboration is difficult because it's not always working with stakeholders, it's not always built into our grants and our job descriptions. And that is why I'm immensely grateful to HAQAST and NASA Applied Sciences for highlighting the need for scientists to work directly with stakeholders. So I will end it there and pass it over to Elsa.
Thank you very much, Suzanne. And so, as Daven mentioned, I work for the Climate and Clean Air Coalition Secretariat, which is hosted by UN Environment. And so the Climate and Clean Air Coalition, or CCAC, is a global voluntary partnership set up back in 2012 with the objective of protecting the climate and improving air quality through actions to reduce short-lived pollutants, or the short name SLCPs. I won't be presenting just because I saw pop-up saying I'm now the presenter. I don't have any slides. But so short-lived pollutants include black carbon, methane, tropospheric ozone, and some of the HFCs, and they were grouped together because of their relatively short lifetime in the atmosphere and their impact on air pollution and health. And currently, the coalition counts 146 partners and is really aimed at providing support to countries to implement a specific set of measures targeting the key emitting sectors, so transport, brick production, agriculture, cook stoves, etc. But in addition to working in this sector, the coalition partners identified quite early on that there was a need also to help countries plan for action to reduce short-lived pollutants at a more cross-cutting level. And so this led to the setup of an initiative dedicated to planning and to the development of a decision support tool to allow partners in countries to evaluate different options to reduce emissions and understand how effective they can be at reducing air pollutants, greenhouse gases, short-lived pollutants, and at reducing the impact of air pollution. And so that's where the collaboration with HAQAST came into play. And collaboration started between the CCAC, the Stockholm Environment Institute, the US EPA, Dr. Daven Henze, Dr. Susan Anenberg, to develop a method to quantify air pollution health impact in a tool that can be used directly by planners in developing countries, even with maybe limited capacity to do so. So the work built on the existing LEAP tool that's developed by the Stockholm Environment Institute, which was already used for energy planning, for greenhouse gas mitigation assessment, but which at the time had not been widely applied to assess strategies to improve air quality. So the team worked on developing an add-on to the tool called the Integrated Benefit Calculator, and to develop a method to quantify the impact of changes in emission for different scenarios and their impact on air pollution, health burden. And I'm not a scientist here, so I can only provide an overview, and Daven already mentioned the methodologies in more detail. But what's interesting, I think, is that the method really allows to understand how much changes in emission can have benefits in terms of PM2.5 exposure and health impact. And where I think is more interesting for me to focus is to talk about how this method has been used and the result of the collaboration. And I think what's really valuable is that there is now a tool that's relatively easy to use and available to planners in developing countries to estimate the expected changes in air pollution health impact in response to different policies and measures. So this is really about helping with planning and making decisions on what to prioritize. And between 2015 and 2019, our initiative has been providing training and support to stakeholders in about 30 countries to help them develop integrated analysis and teach them how to use the tool to evaluate co-benefits. And currently, as a result of that, there are already 8 countries that endorse national strategies on short-lived planet pollutants. And name a few: Nigeria, Ghana, Bangladesh, Colombia, Togo, Mexico, the Maldives, Cote d'Ivoire. And in these processes, the analysis of the different possible policies and measures really provided the basis for extensive engagement and discussion with different stakeholders in the country in order to identify the set of priority action that they could be taking forward. And I think that being able to highlight air quality and public health local benefits of climate change action has been proving very useful to drive ambition, convince stakeholders of the usefulness of taking action. And as Daven mentioned as well, we're now starting to use this approach as well as part of broader climate planning in terms of helping a number of countries develop their nationally determined contributions under the Paris Agreement, for example. So this is also proving very useful there. And I would be happy to get back to some more specific example during the Q&A part of the panel if this is of interest. But maybe to conclude first, I think this collaboration was very fruitful, and we hope it can continue so that we can continue to improve the tool, the methodologies, and also continue applying it in additional countries as well as in cities where much of the activity on improving air pollution is taking place. Over.